Generally speaking, we can't say that all the frozen IVF cycles can be more successful than the fresh ones. It's important to consider why we are deciding to freeze the embryos. In most occasions, we decide to freeze the embryos because of a medical reason, such as risk of a hyperstimulation syndrome, in which the patient had a really high response, and because of that we want to avoid an eventual pregnancy, and we decide to freeze all the embryos to avoid future complications. A different issue is that sometimes we also decide to do what we call the pre-implantation genetic screening to check the embryos. If that's the case, we need to wait for the results of that testing in the embryos, and it's advisable to freeze the embryos before transferring them, as we need to wait for some days to obtain the results. So in the past, it's true that the results with the fresh embryos were much better than the results with the frozen ones. But nowadays, things have changed a lot in the laboratory, and the rate with fresh and frozen embryos could be almost the same. Because of that, it's true that in many occasions we decide to freeze the embryos to do the embryo transfer afterwards. But in most cases, we decide to freeze the embryos for a medical reason, or if we are adding additional tests, such as the pre-implantation and genetic screening one.